my name is Amber Goana and I would like to welcome you to my Med Talk. This is going to be some of the things I pulled from the CPJE California law exam, and as you can see, it's going to be basically like a little Naplex, and so each video is just going to go over each section that I kind of pulled little things from, and I hope you like it. Next, we're going to be talking about medications that have FDA approval for the use in anxiety. First section we got here is benzodiazepines. These are going to enhance gamma aminobutyric acid, also known as GABA, which is going to inhibit the ascending reticular activation system, and the antidote is flumazenil. We have alprazolam Xanax, dose 0.25 to 0.5 milligrams 3 times a day. You want to avoid use in people with liver disease. It has a very fast onset of action, and it actually has the highest risk for abuse. Clonazepam, Klonopin, 0.25 to 0.5 milligrams twice a day. Again, you want to avoid use in liver disease. Diazepam Valium, 2 to 10 milligrams twice to 4 times a day. Again, you also want to avoid use in liver disease. This diazepam can be used for alcohol withdrawal syndrome. It has a very fast onset, so it's going to have a very high risk for abuse, just like alprazolam. We have lorazepam Ativan. It's 2 to 3 milligrams daily. It can be used also for alcohol withdrawal syndrome, just like the diazepam. And it is actually okay to use in people who have liver impairment. Chlordiazepoxide is 5 to 25 milligrams 3 to 4 times a day. You also want to avoid in liver impairment. Oxempam, it's 10 to 30 milligrams 3 to 4 times a day, and it is okay to use in liver impairment. So lorazepam and oxenapam are okay to use in liver impairment. All those other ones you kind of want to avoid in liver impairment. General precautions with all benzodiazepines: they are known to cause drug abuse, and they definitely want to be tapered off slowly because of that dependence that it can cause. You want to avoid use with opioids due to the sedation and respiratory depression that they cause. Narrow-angle glaucoma, use with azoles is something you also want to avoid. Pregnancy, elderly, and also sleep apnea patients you want to avoid. Some general side effects include sedation, dizziness, ataxia, which is just where your coordination is going to be kind of a little off. Constipation, cognitive disorder, which is kind of worsening memory. It's hard to remember things. And they can also cause weakness. The next class we have here is Axionetics. It's buspirone, Buspar. And the mechanism this shows is high affinity for serotonin, which is 5-HT1A, and also dopamine receptors, but it has no effect on GABA binding or enhancing. It takes about 2 to 4 weeks to see effects. The dosing is 7.5 to 20 milligrams twice to 3 times a day, with a max of 60 milligrams a day. This medication, buspirone, should not be dosed as needed. It needs to be something that's scheduled taken daily. This medication is mainly used for generalized anxiety disorder, and it is actually okay to add them to treatments that consist of SSRIs or SNRIs. It is known to cause headache, dizziness, sedation, a feeling of nervousness. You want to avoid use in liver impairment, people who are taking MAOIs, linezolid, IV methylene blue, alcohol, and grapefruit juice. Hydroxyzine, Vistaril, or Atarax is another name for it. This works by blocking histamine H1 receptors, which is going to cause suppression in certain regions of the subcortical area in the CNS, and also cause primary skeletal muscle relaxation, bronchodilation, analgesic, and antiemetic effects. The dosing is 25 to 100 milligrams 4 times a day with a max of 400 milligrams a day. It is usually used for symptoms of generalized anxiety disorder, just like buspirone, but it's not really treating an underlying cause. It's more of like helping with symptoms. It is known to cause QT prolongation, sedation, dry mouth, blurry vision, urinary retention, constipation, and you want to make sure you avoid using this medication long term. So you got selective serotonin reuptake inhibitors, also known as SSRIs. These work by selectively blocking the reuptake of 5-HT serotonin at the neuronal membrane, and it's going to increase the action's levels of serotonin. An example is fluoxetine, Prozac. That's dosed at 10 to 60 milligrams a day with a max of 80 milligrams a day. It actually has a very long half-life, fluoxetine. Next we have paroxetine, Paxil. It's 10 to 40 milligrams a day with a max of 50 milligrams a day. You want to avoid use in pregnancy. You want to take paroxetine at bedtime, and it actually has a quite short half-life. It is FDA approved for all anxiety disorders. We have escitalopram, Lexapro, which is dosed 10 to 20 milligrams a day with a max of 20 milligrams a day, but if you're using it in the elderly, you want to have that and do 10 milligrams a day. Sertraline Zoloft, it's dosed 50 to 200 milligrams a day, and it's a good choice for patients with cardiac risk. Fluvoxamine, Luvox, 50 to 300 milligrams a day. You want to take this at bedtime, so just like paroxetine, take it at bedtime. It has a short half-life, just like paroxetine, it has a short half-life. General precautions in these SSRIs, they do have an increased risk of suicidal thoughts in younger patients in the first several months. You want to avoid use with MAOIs. You want to wait at least 2 weeks, most of them, but actually 5 weeks for fluoxetine because that has that really long half-life. You also want to avoid linezolid, IV methylene blue. Some side effects include QT prolongation, GI effects, increased bleeding risk, dry mouth, diaphoresis, some sweating, tremor, increased risk of fall, and sexual dysfunction. The next set of options we have here is serotonin and norepinephrine reuptake inhibitors, also known as SNRIs. They inhibit the reuptake of serotonin and norepinephrine, and these are also actually used for neuropathic pain. There's venlafaxine Effexor. It's 25 to 150 milligrams a day with a max of 375 milligrams a day. It's known to cause elevated blood pressure in doses greater than 150 milligrams a day. It can also cause QT prolongation. It will only need a 7-day washout period whenever you're trying to switch to like another medication, especially like an MAOI. You want to wait just like 7 days only. It is a 2D6 inhibitor. You got duloxetine Cymbalta, 40 to 60 milligrams a day with a max of 120 milligrams a day. You want to avoid use in creatinine clearance, less than 30 milliliters per minute, and it is a 2D6 inhibitor just like venlafaxine. General precautions for SNRIs, they increase risk of suicidal thoughts in younger patients in the first several months of use. They're going to need that 2-week washout period before you're going to start an MAOI, unless you know it's the Fetisma or the Effexor that only needs the 7 days. You also want to avoid with linezolid and IV methylene blue. Some side effects include all the ones like the SSRIs, but also an increase in heart rate and blood pressure. It could dilate your pupils, cause excessive sweating, as well as constipation. The next set of options here is a tricyclic antidepressant, TCA. It inhibits the reuptake of serotonin and norepinephrine. It also blocks histamine, acetylcholine, muscarinic, as well as alpha-1 adrenergic receptors. Chloripirine, Arnavil. It's used mainly for OCD, and it is a tertiary amine. The tertiary amines have more side effects than secondary. Increased risk of suicidal thoughts in children are seen in the first 2 weeks of use. You want to avoid use, wait at least 2 weeks, for an MAOI. You also want to avoid linezolid and IV methylene blue. The side effects are very, very similar to SS and SNRIs. It can also cause orthostasis, which is lowering your blood pressure, sedation, lethargy, confusion, weight gain, vivid dreams, and lower your seizure threshold. There are other few FDA-approved options for anxiety that don't really fit in one of these categories. Pregabalin, Lyrica. It's a gamma aminobutyric acid analog, GABA, that has a strong affinity for alpha-2 delta site in the CNS that is thought to help with neuropathic pain and seizure control. It's 150 milligrams to 600 milligrams a day. It is a controlled medication. It's a Schedule 5. Next, we got gabapentin. Neurontin's another name for it. It has the same mechanism as Lyrica. The dosing is 300 to 3,600 milligrams a day, and it will require renal adjustment in patients who have poor renal function. And then the last option we have here is propranolol Inderal. It's a non-selective beta-1 and beta-2 blocker. The dosing is 10 to 40 milligrams, dosed 1 hour before a performance or a stressful event. So first-line treatment for a generalized anxiety disorder consists of either escitalopram, paroxetine, duloxetine, or venlafaxine. Your second-line agents are buspirone and hydroxyzine. Short-term, it is kind of okay to use alprazolam, chlordoxepine, diazepam, lorazepam, or oxenipam. In panic disorders, your first-line agents are going to be fluoxetine, sertraline, paroxetine, venlafaxine. And then again, you can use short-term alprazolam or clonazepam. For social anxiety disorders, they recommend first-line sertraline or paroxetine, as well as venlafaxine. For OCD, first-line agents you got here is fluoxetine, fluvoxamine, sertraline, paroxetine. Second-line agent is chlorperazine. For PTSD, your first-line option is going to be sertraline or paroxetine. And that is all that they had listed for the FDA approval use in anxiety. Again, my name is Amber Gawana, and I wish you the absolute best of luck in all your studies.